Dr. Ken Anderson from Atlanta. Fantastic to finally get to speak with you about your inclusion in this year's Best Hair Transplant Surgeons in the World article. You've been in the article since it started. This year, yet again, you're alongside your colleague, Dr. Daniel Lee. And, I just wanted to commend you. Year in, year out, the feedback I get from your patients is so consistent with what my message is about, patients first, education, and enabling patients to get an informed opinion on what's right for them. And you and Dr. Lee provide such incredible, honest, transparent kind of education alongside fantastic hair transplant results. And I just wanted to commend you for being yet again on the article, and well done to you, sir.
Well, thanks very much, Specs. It's great to see you as always. I know we don't get to talk a ton, but it's always a serious and legitimate honor to be included on that list. We've Dr. Lee, my partner here at the Anderson Center for Hair in Atlanta, are both thrilled to be included. I think you touched on something really important there. The ethics of hair restoration. A lot of people, wonder, well, what are you talking about? There are a lot of ethics involved in how to treat patients and when to treat them. You should not often just jump right into surgery, but with the explosion of the specialty over the last 10 years, it's really kind of muddied the waters. And so I think that the list you're putting out, the exposure it's getting, is helping a lot of patients kind of focus their research efforts into ethical doctors who are doing very legitimate work and whose careers are dedicated and focused on treating patients suffering with hair loss.
Yeah, and we discussed the list on the Best Hair Transplant Surgeons in the World article. The list is not exhaustive, as you well know. There's a lot of great surgeons out there, but what it does is it cuts straight to the chase and enables patients that kind of researching hair transplants for the first time. Fortunately, the article has had so many views, millions of views, that it organically ranks very high on Google. And I'm fortunate that at the helm of that article to get the educational message across to the consumer and provide them doctors such as yourself and Dr. Lee, so that patients can get a much more informed and educated opinion on what their requirements are and whether or not, in fact, they actually are eligible for surgery, as we only know too well that this industry is absolutely overwhelmed with clinics that are too readily offering surgery at an affordable price just to get people through the door. They have no kind of, they don't care about the patient's best interest. They're just interested in the mighty dollar. And that's why I'm so fortunate to be able to house surgeons such as yourself and Dr. Lee and provide not only patients in the local area to you in Atlanta, but as I well know, patients travel you to from all over the world. I've liaised with them. And it's fantastic to be able to provide you and your clinic the exposure it deserves, because you trained as a facial plastic surgeon and you've solely dedicated your practice to hair restoration, which is so commendable, because you could have gone down any avenue with the tools in your box to offer different services to people, but you've tried to specialize in hair restoration surgery, haven't you?
Yes, that's exactly correct. I completed my fellowship in facial plastic and reconstructive surgery in 2003. That was the same year I discovered the specialty of hair restoration surgery. And, I spent some time with Dr. Marty Tesler in the summer of 2003. And really, I saw some things I'd never seen before in medicine. Some of the happiest patients I've ever seen. The surgery itself is a very elegant, very finessed endeavor, really enjoyable. And so I elected at that time to dedicate my entire career. I stopped doing nose jobs, facelifts, nasal reconstruction, all that sort of thing, to just strictly treat patients with hair loss. And I'm now currently in my 20th year of treating patients. And I got to say, when I jumped into the specialty, the only people offering it, the physicians offering hair transplant surgery, were mainly doctors who dedicated their entire practice to the specialty. But about since the advent of the FUE devices, the NeoGraft in 2009, and the many others since, over the last 10 or 12 years, there's just been a huge influx in doctors who kind of add hair restoration surgery onto their palette of services, kind of a side gig. It's pretty incredible. When I started here in Atlanta 10 years ago, there were only about the first 10 years I was in Beverly Hills, California, but I was recruited here to Atlanta by Emory University to be the chief of hair restoration surgery for Emory. And I looked at Atlanta. There were 3 other guys, so I would have been the 4th hair transplant surgeon in Atlanta. Currently, there's over 150 practices in Atlanta offering hair restoration surgery. Guys that I do not see at the ISHRS meetings and other national and international educational conferences. It's hard to know where they're getting the education on this stuff. And I see patients who've consulted with these clinics, and sometimes the recommendations are just not on the mark. So it's really tougher than ever for patients out there to pick a doctor that they can trust, to make ethical decisions, who will do ethical and excellent surgical work if required, who will guide them in the non-surgical methods, before a transplant is suggested. And so it's a real privilege to be able to meet with these patients and to educate other doctors. And and you're right. I have, in the last 5 years since I've been on the top 25 doctors list for hair restoration surgery, we have seen a lot of international patients. I think patients from 42 different countries so far, which is a real thrill. We had a guy here from Freetown, Sierra Leone 2 weeks ago. So it's turned into a bit of an international practice. But I really, treating hair loss patients is my passion. I think just like I saw in the summer of 2003, really I've never seen happier patients. It could be absolutely life changing in a positive way if done correctly. I'm proud to say, I want to call out, if you don't mind, some of my other compatriots in the specialty, Dr. Basanga, Dr. Shapiro, of course, my partner, Dr. Lee, Dr. Bowden, Dr. Alexander. These are good friends of mine I've known for years. There are many others on the list. I don't need to name them all, but it's kind of a small specialty, if you will. So I know all these guys. I'm friends with all the guys, and they're all excellent choices to be included on the list. And like you say, there are many others. There are many competent doctors out there, but it's like I said, it's becoming more difficult for the patient to discern, because a lot of these guys who are just adding it on have a slick website and a very smooth and convincing sales process. So I thank you, my friend, for contributing to the well-being of so many patients as they search for a physician to help them with their hair loss.
Oh, well, I really appreciate that. I mean, there's so much to discuss there, and we just want to provide, the viewers of this video the opportunity to yet again get in touch with you. You have been at the forefront of this industry alongside other of you, other colleagues there that you've, just to name but a few. But this is why I've included you in this article, which is so prolific and has gained such exposure, because for the right reasons, because patients are therefore, in my opinion, getting in touch with really trusted, kind of reputable doctors who are going to guide them in a much safer direction. And, well done, Dr. Ken Anderson, because, you really do provide a fantastic service. And you touched on a point there about, giving patients the opportunity to get, the right, accurate information and not misled, because there are so many different marketing campaigns, Instagram adverts, everything that's thrown at these new, naive, desperate hair loss sufferers. And lo and behold, they don't realize what's fully involved in this type of procedure. And they just think it's a cookie cutter type of procedure. And they don't realize actually what goes into it. And the more people that we can educate, the more people that lives we can change and in turn protect, because we know how many repair patients are out there, too many. And this article has actually helped prevent people from jumping in and making silly mistakes. And it's actually prevented people from having surgery, because the message within the article, the main message, it's not about the list of surgeons. It's that surgery is actually a last resort, and it puts people in touch with resources, treatment options, educational literature to enable them to press pause, stop, and get if they want to get an opinion on what their hair restoration requirements are from a surgical aspect, is in touch with ethical, honest surgeons that are going to tell them the facts and not tell them what they want to hear, but tell them what they need to hear. So, Doc, look, thank you so much for everything that you do for your patients and everything that you do for this industry, and your colleague, Dr. Lee. You know, you both do outstanding work. And as I said before, it's not just about the hair restoration itself, it's about the care, the ethics, the honesty, and the transparency which set you and your colleague apart in this industry. And you should rightly so be on this list of surgeons that is the best hair transplant surgeons in the world.
Well, I appreciate it, my friend. It's always a pleasure. And yeah, just like it's one of the things that a lot of patients don't understand. They look on Instagram and they see a surgery being performed, and it really should be the last resort. Hair loss is forever; it never stops. So I tell my patients that these are long-term relationships we're starting, and we should exhaust the medical aspects of trying to regrow hair, or at least at a minimum stop the hair loss before we jump right into surgery. But that's a message that I think is very much diluted in all the media. But anyway, I appreciate you hooking up with me on the video today. It's always an honor and to be included in that very distinguished group of surgeons. And here's fight. You got to fight the good fight every day, and that's I tell it to my staff. You got to treat people right. I do believe in karma, and it's I think we're doing good things for a lot of people with hair loss.
You definitely are, Doctor. You definitely are. So thanks so much, Doc, and we'll hopefully catch up soon.
Very good. Take care, my friend.
Thanks.